And if that's the only thing that I can give from my channel, then it's more than enough. An answer that you can give to a question like that would be something like, while this school is my first choice, I did apply to other programs. Play with that, but something along those lines. If you haven't worked with surgeons before, let's just say they're a special breed. Hi everybody, welcome to my channel. My name is Kaylana, and if you are a returning viewer, then welcome back. If you're watching this video, you've done the time, you've taken your tests, gotten your certifications, sent in your applications, then lo and behold, you've been requested to do an interview. Congratulations. In this video, I'll give you 10 example CRNA school interview questions and tips on how to impress your interviewers. First, I want to thank everyone for all the love and support that I've been receiving. I appreciate everyone who has subscribed. I got a lot of feedback, and I've even gotten a few private messages on my Instagram. So with that being said, interviews are different for every school, just like the criteria for the candidates that they accept. But regardless, they are interested in you, they see that you are qualified, they want to get to know you. So what are CRNA school interviews like? Well, by doing additional research, you'll probably be able to find what type of interview your school will do for you and be able to prepare accordingly. But I think it's so important to prepare for the unexpected, which, if we're being honest, is what makes a successful CRNA. I wrote down the questions just so that I won't forget any. So the first question, why do you want to be a CRNA, or why our program? I was not asked this question, but I think that it's something to prepare for because I think that it is a great question. Why do you want to be a CRNA? Coming up with your elevator speech, as they call it, so that you can sound natural but have something that's interesting, maybe something that will help them remember you after they've talked to all of their applicants, is going to be helpful for you. So why do you want to be a CRNA? What is your story? Do you remember the first time that you ever thought about being a CRNA? Thankfully, I wasn't asked this question because, as simple as it sounds, it's actually very tough, considering that money can't be a factor. While the money is enticing, it's very enticing. That can't be your reason for doing something as potentially stressful and as serious as this job will entail. Knowing something about the program definitely helps, but maybe they can offer some of the best clinical locations of the programs that you've taken a look at. Maybe they have a simulation lab that is state-of-the-art that they've gotten awards for. Looking into your school might actually help you answer that question. I remember I was doing research for the school that I interviewed for, and in doing the research, I learned things that I didn't even know. I mean, to be honest, I applied to multiple schools and they were all good schools, so I would have been happy to go to any one of them. But during my research, I actually got excited about the school that I got accepted to, and in doing your research, you might find that you will too. Another question that seems simple but might actually be difficult for you to answer is, tell me about yourself. I mean, they do want to know about you, but not necessarily what your favorite food is. While I was doing research for this question in preparation for my interview, I found suggestions saying something like, think of 3 things about yourself and then tie them into why it would make you a good CRNA. So one of the examples that I can remember is that I have taken a liking to growing plants. What does that have to do with being a CRNA? Well, it requires a lot of patience. It requires attention to detail and good assessment skills, because my plants can't talk to me, but I can tell when something's different about them. I can actually tell when they're not happy, which sounds crazy. It's like a crazy plant mom type thing. But one of my plants doesn't like a lot of light. So I've actually had to bring that one inside. I noticed actually within hours, no joke, the improvement. My point is, my love for growing my plants shows that I have good assessment skills, I have patience and commitment. That's how I would present it. Think of 3 things that you love or that you're passionate about and figure out how that somehow ties into how you would be a successful CRNA, because you'd be surprised, it probably does have a lot to do with what would make you a good CRNA. Number 3, what political issues does the profession face? and I was asked a version of this question, and this tells whether or not you are truly interested in the world of anesthesia. I mean, past, critical care, taking care of your patients, you liking a challenge, the money being enticing. What else do you know about the profession? So if you go to websites like the AANA, you can find different things that the association is working to improve for CRNAs, and it's actually quite interesting. So I'll give you a hint. There's some turbulence in the relationship when it comes to CRNAs and the MDAs, or the anesthesiologists, the physicians. There's also anesthesia assistants. So knowing the roles of these three entities in anesthesia and the challenges that CRNAs face as far as recognition, independence, I'll say respect, because while we do work together, some of the MDAs don't feel that CRNAs should be able to work independently, and being able to discuss this and your opinion of this will show that you're invested in the profession. So number 4, describe a time where you made a mistake and what was the outcome. Preferably this would be like a clinical type mistake that you made. And the purpose of this question is to identify that you're not perfect. I mean, we all know that we're not perfect, but being able to identify your shortcomings and also elaborate on how you were able to fix the situation and or what you learned from it is an example of an emotional intelligence. Number 5, describe a time when you were working with a difficult provider and how did you handle it? This is another example of emotional intelligence, and if you haven't worked with surgeons before, let's just say they're a special breed. Gotta love them, but sometimes it gets challenging. So you need to know how to handle yourself. So the purpose of this question is to demonstrate how you handle authority figures. The answer to this question isn't necessarily to, cower down, but more so to be able to collaborate, handle a tough situation, and to assert yourself. An assertion is different from aggression in that being assertive means you're being respectful of the other party while getting your point across. So CRNAs in many states can practice independently. So an example that I saw while doing the research was, what if the surgeon told you to give a drug that you didn't think was necessary? And that's a tough situation. As a CRNA, you're going to be the provider, you're going to make the decisions, versus being an ICU nurse where you probably did have a lot of autonomy because you have to make these decisions on a split second, but ultimately, you have to collaborate with the physician. In the CRNA world, you are the provider. Number 6, what does a CRNA do? Make sure your interviewers know that you are aware that you are the #1 patient advocate in this scenario when they're under your care. Yes, you can go down the list of the different physical tasks that you take care of, or even the different things that you might be responsible for, but speaking for the patient where they're not able to speak for themselves is CRNA's #1 job, in addition to keeping the patient safe and comfortable. Number 7, what's the difference between a physician anesthesiologist, a CRNA, and an AA, an anesthesia assistant? Knowing the difference between these things shows that you have a sincere interest in entering the profession of anesthesia. Number 8, what preparations have you made to enter CRNA school? During your research, you might have found that CRNA programs aren't cheap. During my research, and I'll probably make a video about this later on, the cheapest anesthesia program that I've seen was about $35,000 altogether. And then the average, I would say, is anywhere from $70,000 to $100,000. I have seen some as high as $225,000 for the entire program. So in asking this question, they want to know, how have you prepared? Because most programs take on average about 20 students, and they want to know that you've done what you needed to do, or at least have some sort of plan as to how you're going to enter the program and how you're going to finish, because this looks good on them also. They don't want someone who has to drop out because of something like financial situations. While we can't always predict what's going to happen and have an answer for it, having a strong plan as to how you're going to make it through CRNA school when it comes to the curriculum, when it comes to stress, and when it comes to finances and family is going to show your interviewers that you have planned ahead. Again, another good characteristic of a successful CRNA. Number 9, what are your plans if you don't get accepted to CRNA school? Another one would be, have you applied to other CRNA schools? And the reason for these questions is to know that you're not just going to give up. They don't want to know that you put all your eggs in one basket and that, you give up easily. If you haven't noticed, a lot of these questions are going to tell them a lot about you. They're going to infer a lot from what you say. With a question like this, you can say, if I don't make it into a CRNA program this year, well, I'll continue to gain experience. I will work on getting an additional certification. I will continue to strengthen my resume. I would like to dedicate more hours to volunteering. The sky's the limit. But whatever you say, don't say that this is going to be the end of the road. As far as applying to other schools, be honest, because the program wants to know that this is your passion. An answer that you can give to a question like that would be something like, while this school is my first choice, I did apply to other programs because becoming a CRNA is a passion of mine. It is a dream, and I wanted to do all that I can to solidify the opportunity. Play with that, but something along those lines. Number 10, tell me about your unit. And this is the type of question that has the ability to take you anywhere, so be careful about what you say. We are coming from different backgrounds, be it medical ICU, neuro, peds, cardiac, surgery, trauma. If I forgot any of the ICUs out there, please forgive me, but they know more than you do, and they have varied experiences also. So when you bring up your unit and anything within your unit, make sure that you are very proficient in whatever it is that you're about to say, enough to be able to teach about it. They know where you came from, they looked at your resume. Okay, so tell me about your client population. And I said, all right, well, we recovered fresh hearts, we took care of patients with Impellas and balloon pumps and ECMO and this, that, and the third. Okay, tell me how an Impella is different from a balloon pump. So for my CVICU people, would you be able to answer that question? For my other ICU people, you would not be expected to know the answer to that question unless you brought it up. For the life of me, I don't know why you would be in a different type of ICU bringing up things that you've never worked with, but it has to be said because I'm sure it has happened. Just know whatever you bring up is fair game for them to ask you about, so make sure that you know what you're talking about. So those are examples of questions that you might come across during your CRNA school interview. During my research, I found that there was basically 2 different types of interview questions, be it clinical and emotional intelligence. So your interview could be heavily based in one or a combination. Mine was primarily emotional intelligence, but there's definitely a clinical side that you should be able to discuss. For example, if they gave you ABG values and asked you, what would you do? Would you be able to answer that question? I would definitely suggest studying, like brushing up on your CCRN study guides, knowing all of your lab values, knowing a few of the different vent settings. Even as far as pharmacology, they'll want to know what receptors does a certain drug work on. So for example, what receptors does phenylephrine work on? What receptors does norepinephrine work on? How are the 2 different? I have seen study guides suggesting that you know the cranial nerves. Some interviewers will ask you questions that they know you don't know, just to see how you're going to handle it. And the purpose of this is, 1, it tells them how you handle what you don't know. Are you humble? Are you comfortable with showing that you don't know everything? Coming from being a very strong ICU nurse, I wouldn't suggest saying, I don't know, but saying something like, I don't have the answer for that right now, or I'm not quite sure, but I know where to find the answer and get back to you. Or they want to be able to have the opportunity to be able to share something with you and see how you receive it. The interview is going to tell them how much you know about the practice, clinically, and even about yourself, but it also is going to show whether or not you're a good fit for their program. So during your interview, be yourself. Find a way to relax. For me, that meant that I needed to look up as many questions as possible to figure out what I might say, because you don't want to sit there stumped. That's not a good look during your interview either. There's also services out there that you can pay to have them do mock interviews with you, get feedback to figure out how to improve. If you're interested, comment below and I can give you a link to a couple of the services that I know of. And now I just want to give you a few tips on how to improve your chances of acing your interview. Pay attention to the way you dress. This is probably the most professional experience that you're going to have thus far in your career. And it's not out of the question to go and buy a suit. There's a difference between dressing nice and dressing professionally. And most of us are entering levels of professionalism that we've never been in before. So for my interview, I did go and buy a suit jacket. I had a Zoom interview, so the bottom didn't really matter. I had on a suit jacket and I had a dress shirt underneath. And then I had my hair back in a bun and I had on earrings, had makeup on, but it was very clean and professional. If these tips have been helpful to you so far, please like, comment, and subscribe. And by hitting that notification bell, you won't miss a single video that I upload. Another tip that I have is to remember the names of your interviewers. I sent thank you emails to both of my interviewers and I kept it short and sweet, and I didn't expect a reply, but I wanted to thank them for their time for interviewing me, and I also made it a little bit personal so that they could remember who I was. I don't know that that's what helped me get into CRNA school, but I do know that it shows that you take an extra step and it is professional to thank the interviewers for their time. A big tip is to ask questions. During my interview, I asked if there were any extra resources available for SRNAs to use if they felt that they needed a little bit more help with the topic. In addition to requesting office time with the professor, ask questions that you can't find in their handbook, on their website, or during information sessions, which leads me to my other tip. If the school offers an information session, sign up for it and actually attend it. It just shows that you are interested in their school, you're interested in the program, and it looks good for you. So if you're still watching, I hope you all enjoyed this video and you found something helpful out of it. And I hope to see you all on my next one.